but also the title of the session that we are going to be feeding into at the forum is Protecting and Investing in the Youth and Early Career Workforce. Ave, may I have the next slide, please? So what is this fifth global forum that we're talking about, and why is it important? So usually about every 4 years, but this time it's been a little bit longer, there is a big forum that happens that is organized by the WHO Health Workforce Department on Human Resources for Health that brings together policymakers, various actors from the health workforce, professionals, early career professionals, students, as well as educators and private sector, etc. Anybody who is in any way involved in health workforce development and planning, as well as health workers themselves. So this forum this year is happening in a bit of a different fashion. It's going to be a hybrid discussion. We're going to talk about how you can engage in that forum, but it will be held from April 3rd to April 5th. So coming up next month in Geneva. So over 5 years ago, there was the Human Resources for Health Workforce 2030 that was adopted at the World Health Assembly. So this forum is going to reflect on that strategy, where we are at, and then looking at evidence and what are lessons learned on workforce development since then. More importantly, as you all know, the health workforce has been particularly affected during the COVID-19 pandemic. Major challenges, but also some lessons learned as to usually what not to do, not so much as what to do. As we mentioned before, we're going to have decision makers, many people from governments, from funders, education, finance, colleagues from the gender space, health and labor employment, and migration. We will also have a big focus on youth, and particularly on what I mentioned on protecting and investing in youth in the health and care workforce. So this is an opportunity for us to talk with you in your individual capacity, in your organizational capacity, and hear your input that's going to feed into a high-level roundtable with policy makers, people involved in the finance aspect, the investment aspect, as well as health workers from all over the world. So I am going to stop here and hand it over to my colleague Ave, who's going to take us forward.
Thank you, Colleen, and hello to everybody from my side as well. So firstly, if you have not yet registered for online attendance to the event, so the Fifth Global Forum, then please do so. You can also, of course, search on Google or from the WHO webpage, or alternatively, you can scan this QR code, which opens also the registration form. I won't stop for long on this slide. You will be able to find it on your own as well, but I'll move on to the Youth Hub consultation. So what is going to happen there at this event? There will be, among other panels and roundtables, also one session where the Gwen Youth Hub will be speaking about youth and early career health professionals. So we will be organizing a high-level roundtable at this event, which is mainly focused on protecting and investing in the youth and early career workforce. This roundtable has several aims that it wishes to achieve, and several topics it wishes to explore. Those are mainly related to exploring policy solutions on how to make the health sector attractive to the youth, how to also recruit and retain young health workers in places where they are most needed, for example, in rural areas. In addition to this very important topic for the World Health Organization and also for us, obviously, globally, is how to increase investments into the human resources for health. section. So let's say how to invest more into young health workers globally. And of course, the topic that the Youth Hub has been very closely following and discussing also with its members, which is decent working conditions, and decent pay for young health workers. So this is the concept essentially around the round table, and currently what we will be doing throughout this session is collecting your inputs. So we are reaching out to both our stakeholders and also our members, our constituencies, in advance of this event, to get your ideas and your inputs for us then to go and take to this roundtable discussion with others involved in this event and with the high-level policymakers and then member state representatives. So in addition to this consultation today, there will also be a stakeholder survey. After the end of the consultation, I will also share with you this stakeholder survey for further dissemination, of course. And this will remain open for a couple of weeks then. Again, to gather more inputs from both you and also your colleagues and organizations. So without further ado, we will start, and we will be running this session mainly using Mentimeter. Maybe some of you have used it before as well. It's quite easy. You can either scan the QR code if you are following via your computers, or alternatively, you can also go on your mobile. You can open the browser, you can type in menti.com, and then you can enter this number there that you see on the slide. I'll give you a couple of seconds to do this. And then I will share with you the Mentimeter. All right, I presume most of you have either scanned it, or if somebody is also having issues, then please either write into the chat, you can send a direct message as well. And I see if somebody has very kindly already written the code also into the chat, so you can easily copy paste it onto menti.com. All right, so let me share with you the Mentimeter. It's a very nice and interactive way of doing these things. And I will share with you the screen so you can see also each other's responses and replies. Just a second. All right, so we're starting with some warm-up questions. The first warm-up question is stating which organization you're part of. I believe you can state up to 3 organizations, but ideally, yes, the main one is the one most of interest to us. And this is a word map, so the bigger words represent more people than replying. So we see that IPSF is quite heavily represented, also the WFPHA, Euronet, and the others a bit less. Let's give it a bit of time. I see 11 people have replied. There are a bit more of us on this call. If somebody is having also issues with accessing Menti, you can also write into the chat. You can just like give your contributions via also the Zoom chat if you can't open Menti. So that's not an issue. All right, 13 people. Let's give it a couple of more minutes. And whoever is joining now, you can also just, as you see from the screen as well, you can go to menti.com and you can enter the code. So you can join whenever you wish. It's not an issue at all. All right, so let's continue with the next question. Why have you joined this consultation today? Again, I'll give you some time to reply. You can write a bit longer replies to this one. All right, there's one answer. There are, okay, a bit more. All right, and everybody who is joining us now, then please go to menti.com, enter the code, and join the discussion. Join in providing your inputs today. I will shortly hit enter as well, so you see the answers from each other. All right, so what have people said? People are here to learn to represent youth voices and to help youth and us also then identify youth needs, also to meet associations, people in the global health scene, to network. All right, what else? How youth health professionals can contribute to a more sustainable working environment for future healthcare. So all of these are topics actually related to today's discussion, right? How to feed into the roundtable at the forum, how to increase youth participation or participation in health workforce, also as it digitalizes, learning purposes as well. Also to share success stories. That's also one question that we're looking forward to hearing more about. And also to discuss, to understand the policy demands and to stay informed. All right, very, very nice answers. Let's see if there are any more coming in. Right, so representation and inputs and also networking are included here. Very, very nice. All right, so these were the warm-up questions, and let's now start with the key questions that we have also set for the roundtable. These will probably take a little bit more time, as they are the sort of big questions that we're also constantly discussing and trying to solve these big issues, but try to give your best. Also, if you wish to comment, I'll give you time for this as well. Once we have gone step by step through each question. So we'll be answering and then seeing if there's anybody who would like to further share from on their behalf. All right, so this is the players are joining to answer to the first question of the 5 questions we have. All right, so everybody on your phones or computers, you hit join, or I think you should see there a button to join. All right, 13, 14. There should be a bit more of you. And once again, if somebody has issues joining Menti, then please do write your answers on the chat on Zoom. All right, so let's begin then. You can always join whenever you wish as well. So all of the answers are correct. And this is the first question then. So what actions are needed to provide decent work and improved conditions for all youth and early career professions? Take time. There is time. There's 5 minutes for you guys to answer. Think through what you want to write. I will mute myself as well shortly. And if somebody wants, you can also add things into the chat box of Zoom. All right, so 8 people have replied. There is still time. So we're talking then in this case about decent work, about working conditions, how to make working conditions better, how to improve them for youth and also for early career professionals. So we're not talking only about already established health workers, but also health students, health and care students, and then, yes, of course, also healthcare professionals. If anybody also has examples of good practices or something that has been done in this area that you know of, then also please feel free to share. All right, so everybody has replied. So let's read through what we have here, and if anybody wants to add, then you may also raise your hand. I will see this, and you can also comment in addition as well. All right, so what do we have here? Standards for workplace well-being and safety, removing barriers to training and education, especially financial barriers. We will be talking more about financial barriers as well in the follow-up questions. Also, adequate remuneration, adequate pay. We also have comments about stability, reliability, improving then the possibility to express ideas, to create a workplace where there is respect towards each other. And also then there are comments about better resources to both work and also learn. So also workplace learning is an issue, work-life balance, effective education, responsibility. Guidance as well. Guidance is also an issue that through literature reviews that we have also conducted previously has come out. So there is not enough peer support. And also decent work depends currently on what career has been chosen. This probably should not be the case, right? Everybody should have access to decent working conditions, regardless of the chosen careers. Increase access to high quality training, up-to-date resources, so at all stages, so starting in your careers and later on as well. Supporting work environments, paid internships, that is also something very relevant, and the kiosk in a lot of cases as well. Consulting people impacted by the actions in order to co-construct them, taking into account their priorities. All right, so accounting for people's priorities, decent pay, non-toxic workplaces again. So there is a lot of reflection going on, which is related to having a meaningful work team, also reliable tutors, proper training and education, also once universities are graduated and people start working. Facilitating career growth, improving mentorship programs, and also making sure then that youth are prioritized in policies. Yes, that's also a good thing to mention, and it's very good to see that this has been mentioned, that also youth are included when it comes to formulating this sort of health workforce policies and also at work site policies. Good secure employment contracts and support and self-development. So self-development tutoring again is coming through heavily. So I walked you through, and you also read what you have responded. Is there anybody who would like to share some personal experiences or further provide details on this matter? Feel free either to unmute or also just raise the hands on Zoom. All right. So if for this question we do not have any additional comments, then let's move on to the next one. Also, feel free to write into the chat as well. So in the chat also, there has been mentioned that encouraging entrepreneurial skills is also something that currently is we are in lack of. So all right. So let's move on to the next question then. All right, I see everybody is ready. So let's begin. Once again, there are no correct answers. So this is now moving into attracting youth into rural areas. So I mentioned before that one part of the roundtable discussion will also be focused on how to attract and how to retain youth meaningfully in areas where there currently is a grave lack of healthcare workers. In this case, we have brought out rural areas, but of course you can also broaden this concept to perhaps areas where there is a need for health workers, but for some reason, for different reasons, there aren't enough of them. So once again, I'll mute myself. I'll give you some time to reply and respond.
But for me, I feel like in the rural areas, like the way I've said, is everyone hearing me?
Yes, I hear you.
Hello?
Please continue. Yes.
Hello?
Yes, I hear
yeah.
you. Shadrach, please continue.
Sure. But for me, like in the rural areas, I think what they have to do is improving the rural conditions. Most of the times run away just because, especially those that are used in towns. Sorry, I'm at school, I'm a teacher also, so I'm busy. There are like some conditions like those people who are used in town, can you comfort go out, please? Yeah. Oh, so they are not, sorry, they are not used being at the villages, so they feel like it's very hard. So at least if the government should be improving some conditions in the health facilities, like the areas at the facility, like networks, especially here in Africa, most of us, we like phone networks, yeah. Like when you go at the villages, you feel, I say, how will I be communicating with people like that? So at least in the health facilities, they should be improving such kind of stuff. Like also, we also have electricity. Most of our African countries have no electricity in the rural villages, So at least if they can do that, I think can be better. Many people be liking it despite because they'll be accessing whatever they want. And they also accessorities like load access of the loads. They're impassable here in Africa. So I think that way, especially here in Malawi, I'm from Malawi, right? So in Malawi, most of the loads are impassable like that. They're not tarmac. So it will be somebody is feeling like that, say, if I'll be at the village, how will I be surviving? It's like conditions.
Yes, thank you very much, Shadrach, for the inputs. And this is these topics, all of these that you have mentioned now are extremely relevant. Governments often lack resources to make these working conditions better as well. And then young health workers and also actually established health workers do not want to go to work in villages, although there is a very great need. And then they are often centered in the cities as well, right? Thank you for the inputs. I see also that that the others have provided their inputs as well. So let's go through what is written here. The first one, which I see here, is related to connection, connecting rural areas then with more central areas to break the isolation. So there's also not only then a lack when it comes to these basic resources to work and provide care, but also these infrastructural resources in addition, for example, road connection and such. I see also, before I continue reading on these, I see that Paul Anthony, you have raised your hand. Please unmute yourself, and the floor is yours.
Hello, can I
Hello.
can I be heard? Hello,
Yes, I hear you. Mhm.
Okay, so I actually agree with Shadrach, if I'm not mistaken. So I'm from the Philippines, and yeah, I kind of have rural experience already. So I kind of agree with the access, no? We need access to roads, and I think what we not really talk about for now is actually the equipment involved and the facilities. So regardless if we already have manpower in the rural communities, if the manpower requires a tertiary level hospitalization, that is still that's still irrelevant of what we can do. Say for example, if the patient experience a hemorrhagic stroke or even just a stroke in general. So I think we need to have access to tertiary level care for those patients already. So if we're talking about attracting rural health youths, youths to the rural health sectors, they need to have a level of equipments to have them access, or rather use, to that setting. That's all lang. Thank you.
Thank you, Paul Anthony. Again, very good inputs regarding also the tertiary care and also resources. So very often in these areas, tertiary care is provided only in city centers, and this might mean just a couple of centers in a country. Yahaya, you would like to provide your comments, please unmute.
Hi everyone, just a quick one. My contribution will be, was most of the what we call the rural areas limited in such a way, if somebody is posted there, there is no any other source of income, especially for those who are employed by the government. So most of them, they will want to run to go work somewhere else, which will be well paid and so forth. If there are two things which we can be able to be done. First, maybe if could be plus the research centers located over there, so that they can be able to get another source of incentive. Also, if they are deployed colleges or sort of teaching institution, which somebody could be able to earn a second income, also could attract more youth. And another thing also, we could also employ what we call a rotational style of method that somebody could be able to use, could work like 6 months in this rural area and then given a chance to go to urban area and then go back to that, so that they are not missing out. That's all my contribution. Over to you, Ev.
Thank you. Very concise points. Also regarding the rotation, this is also a very good recommendation, actually, to be looking into. Very good. All right. I see no more hands are up at the moment. Let's see what we have in the chat as well. So people have mentioned that transportation and connectivity are key, most certainly. Also, there are innovative technologies available then to connect rural healthcare camps with tertiary centers, and this should be more implemented and should be implemented better. Very, very good point. So there are the means to do these things, but they are not used to the extent that they should be. Also, what else in the Mentimeter has been mentioned is that perhaps there should be different types of payment models when it comes to incentivizing young people to also go and work in villages and also go and live. In some cases, I also have colleagues who work in villages, but the villages are very nearby to the big cities, right? So already then we introduce a little bit of a bias. So it's going out of the city center, but still in this case, not reaching the most distant and most rural areas. So how to encourage youth then in rural areas that they should have working opportunities, perhaps during their studies as well. They should be incentivized and taken and provided these experiences. Definitely good compensation, additional compensation could be the case in order to incentivize further youth to move to those areas. All right. And what else do we have here? So, okay, a relatively good internet connection and electricity. So again, we talk about infrastructure, very good points, more funding, capacity building, and also understanding the rural community, right? So research on this matter has also found that people from rural communities who study in cities, they go back to the rural areas more than people then who are from cities. So perhaps there's also a way to then further increase the understanding of the rural community to work there, to study there as well, to do rotations, and perhaps, as Yahaya also mentioned, then to go and rotate, right? So for a couple of months you are in rural areas, for a couple of months in the city. And also there's also a mentioning here of it potentially being an alternative working space for alternative for military service in some countries. Perhaps to offer scholarships for students as well and support them further in going there. Paul Anthony, would you like to add something?
Hello, can I be seen?
Yes.
Hello.
I see you. Hello.
Okay, so hello. So I'm from the Philippines again. So actually I think you had like a good idea there about providing scholarships to those people who are already there. So most likely for people who are already from those rural areas are going to be employed or like be are more encouraged to work in those rural areas rather than those who are already in the cities. So if it's better for me, I think we have scholarships on those specific areas that have the need for rural health workers. Yeah, so I think that's all. Thank you.
Thank you. I just noted this down as well. So scholarships could be provided also and further incentives to people from rural areas. And this is also what Pablo, I think, is writing in the chat. So before bringing new people from other cities, priority should be given to providing incentives and good working conditions for those exactly who were born in those rural areas and then had to migrate for different reasons, right? So this is on the same note as well. Very, very good points. All right, so if all right, so maybe let's move to the next question. We still have a couple of more to go through. I feel the discussion is going really well. So everybody is ready, so let's continue. So what solutions? So now we are trying to brainstorm a bit about solutions. What solutions are most effective to scale up education and jobs for youth? So we were discussing before some problems, and now let's try to put on another hat and think in a constructive, progressive manner on how to do this when we talk about education and jobs, and increasing these opportunities for young people. Perhaps also somebody has some examples to bring. You can also bring examples from outside the health sector or within as well, however you feel is more relevant. Because what we have seen, and I'm maybe talking a couple of words, I'll talk a bit about the background of this question. So following the COVID-19 pandemic, quite a lot of young people do not anymore want to go into health and care, due to different reasons, right? So some of the reasons might be also related to them being more afraid to also contact COVID. There are also other issues which are related to finances, alternative career opportunities, different things in different countries and contexts. So one issue, knowing that there is a grave lack of healthcare workers globally, which is worse in some regions of the world, we really want to think and find ways how to motivate and also how to then scale up these opportunities to study within the health and care sector, and also after graduation to get a job and to go into different career paths within the health and care sector. And yes, perhaps also on the same topic of this this current question, different countries have seen also, for example, people who started in healthcare moving to sectors such as public health, global health. So things where you do not have such a direct contact with patients, for example, in some cases. So there, if you have similar examples to bring, or also something completely different, perhaps when reflecting on what changes COVID-19 then made or had within your community or the country where you're from, then please also feel free to share. And once again, if somebody wants to speak and share, then feel free also to raise your hand or write into the chat. So we have a couple of more seconds to go, and then let's see what people have replied. All right, so what do we have here? Starting from the middle, internships that go beyond desk tasks, decent pay and working hours, interdisciplinarity within the curricula, and entry-level jobs with reasonable requirements. So here are a lot of very good points. We'd love to talk also about interdisciplinary education, professionalism. Universities also have these written as their criteria for a good curriculum, but very often these things are very difficult to do, right? And even more difficult when we enter the working market, where we often cannot even collaborate that closely with interdisciplinarily with our colleagues from other sectors, and even with different sectors within the healthcare realm. All right, so include them in developing educational curricula. Yes, most certainly train them, ensure they have developed the skills for what is actually being recruited for in labor market. So once again, teaching students for what they will do once they graduate, right? So also talking about career opportunities and making them ready for the labor market. Encouraging workplace policies of equal opportunities and career development for youth. Then education, of course, depends also on different kinds of work opportunities that are available, okay, and that also depends on which specializations can be done. Some of you mentioned policies addressing work-life balance, also a very important topic in order to prevent burnout, increasing access to education, strengthening also vocational training. All right, investing in technology, wider poverty alleviation, very important points as well. Supporting entrepreneurship, supporting also innovative technologies such as AI applications and incorporating them to improve the sector. And once again, increased pace for more investments, economic stability for health and care workers. That is also related then obviously to decent working conditions and burnout, preventing burnout. Providing more employment programs, more internships for young people to take part in, perhaps also during their undergraduate studies already. Partnering with local educational institutions, having joint scholarship, joint partnerships between institutions, again, to invite youth more into the field, motivate them, provide, let's say, these good incentives. And also to see that to ensure that during postgraduate training, teaching is prioritized over being just a cheap labor. This is also something that we witness a lot in many regions in all over the world. Very often when it comes to young health workers having either lower salaries or during their internships being the ones to go and do all the work, to do also extra hours and whatnot for not enough pay and support. Also to make then yes, more attractive the jobs again to young people. All right, very good comments. Perhaps let's proceed. I see there are no hands up on this one. Let's continue with the fourth one. All right, the players are ready. Whoever has joined us later, please go to menti.com on your phones or computers and put the code. It's on the slide up there. So then you can also join and contribute and provide your inputs. If you want to, you can also do so via the chat function on Zoom. All right, so we have the fourth question now. The question is the following. What actions can be taken to lessen the financial burden on students and early career professionals? We did talk a little bit, and you replied a little bit already in your previous responses on this matter, but perhaps more focusing then on tangible actions. Also think of perhaps maybe other sectors or some good examples that you have heard of or witnessed yourself on how to support students in decreasing their financial burden. Very often this comes already from studies, right? So people take loans, educational loans to pay for their studies. Afterwards, they have these huge financial burdens to carry when they start their careers. as early career professionals. So what could be done? How could this financial burden be decreased, and how could they be supported when they start their careers within the health sector? Again, if somebody wants, write in the chat, raise your arm, or just unmute and provide some comments. I'll mute myself now. All right, I see that Yingtsun, you have your hand up. Please unmute yourself.
Yeah, so I guess I think this question is particularly interesting because we at least in the US, like people have been trying to address rural health like in variety of ways. One of the ways to reduce it is the federal loan forgiveness program, which means that students can basically go to 501(c) nonprofit making institution to work there for a period of 10 years. So, and your loan will be forgive, like however much that you borrow from the federal government. And I guess another way to reduce financial burden is it's like more funding from the NIH. We know that residency programs in the US, it's bottlenecked by the NIH funding. So without more funding from the NIH and more budgeting from the Congress, it is essentially like very difficult to get more residency spot like in rural areas. And a potential way, perhaps also like a little bit conflict, going into a little bit like conflict of interest. It's a partnership of private sectors. I think that would be a great solution, but at the same time, we need to think about like there's a potential conflict of interest, and lastly, I think there's like for the loan forgiveness program, like at least in the US, we also need to think about like how to make the criteria a little bit easier, because now we know like the residency program, either for pharmacists or for physicians, it's less than 10 years. So you and the criteria is for you to stay in a like the same institution or the institution with the same 501(c) status for like a period of 10 years, and it's like extremely difficult for them to do that, and a lot of them will be disqualified because they move on to a different hospital, to a different institution that doesn't have the same status. So I guess that will be the main issue. Yeah, thank you.
Thank you, Ingsun. This is a very good example. And also I like how you tied the rural aspect with the potential of then deleting the loans, let's say. And also, yes, it's also good to know that in the case, this is a model that kind of works, but also doesn't work. Because as you said, 10 years is a very long time. People tend to rotate. It's actually advised to rotate, not stay in one place for 10 years. So this is also another issue to tackle when it comes to similar programs. All right, so everybody else has also replied. Let's see what we have here. So better pay after leaving training, and also reducing then educational fees, providing further scholarships, and also lowering interest rates for educational loans. They should have already quite low interest rates, but that again depends on the country and the context as well. And in different countries that can be very different. So free accessible certification programs to encourage exploration within respective fields and all aspects of healthcare. Again, here also somebody has mentioned involving the private sector in relation to also job placement schemes. Again, as Yingsun also mentioned, there could be some potential conflict of interest, but there are also ways to deal with this. Reducing educational costs and loan forgiveness programs, yes, as you mentioned as well. So there can also be, yes, further scholarships. Students that loan payment should be started a couple of years after graduation. There could be also additional grants. And also a very valid point here, which is in the center of the screen, is that in many regions of the world, studying a career in health is already a privilege and not a right. So there's a huge bias in access to education, and this is extremely true. And also seen across the health and care sector, and it's more severe in specific countries. Reducing taxes for young professionals, also international grants and merit-based fee waivers is something that has been mentioned. Paul Anthony, would you like to mention something or?
No, I'm good.
All
I'm
right.
good. Thank you.
Good. Okay, good. Okay, so this is definitely a hot topic, and if anybody has further inputs as well, then you can later at the end, I'll show you the form, the Google form, so you can also provide additional comments if you feel that something is not yet mentioned here. All right, so let's move on from this question to the last question. So we have the players ready. And let's see, what is the last question? So last question is related to governments. More specifically, how can governments engage youth and early career professionals in policy dialogue and decision making? So this is also something that the Youth Hub is trying hard to achieve. And also perhaps some of you have read the call for action, where also the governments are called to action in also including youth more in policy dialogues and in actual decision making. So not only having us there or written on paper that yes, we included some youth, but meaningfully incorporating into decision making and policy making young individuals and early career professionals. All right, so I'll mute again and I'll give you some time. Paul Anthony, please.
Hello, can I be heard?
Yes.
Yes, sorry for that. Sorry, So I think one of the ways to engage the youth is actually in increasing the like these ones are organizations and or forums where they have what they say, and I think one of those would be like small organizations. I think like in the Philippines, they don't really have a lot of say because most of the decisions are made from adults or made by adults rather. And I think a lot of it should be, a lot of youth should have education as well on how to decide. But yeah, I do agree with, thank you.
Thank you, Paul Anthony. Very good comments. You mentioned also, I was just making notes that youth should also be educated on how to decide. This is extremely true as well. So it's very easy to say that you guys don't know anything. You just came out of, from the university, or you just started your careers, or maybe you're even a student still. So we won't include you. But this is definitely not good. And also you should be then already perhaps trained and educated on these matters during their undergraduate studies. And also given more exposure to these policy topics, and also how decisions are actually made within the health and care sector.
Yes, I agree, but I like to add one more. I think one where the youth right now is more science oriented, if I'm not mistaken. So we can have research based decisions, or rather research based or research backed evidences, where we are more inclined in making a decision or a policy, or making policies for that. So I think the traditional in what I know is traditionally policymakers are more of what they know, or what they can feel, or what their constituents tell, but we can advocate for a more research backed or a study backed decision making process. I think that's
Yes, I completely agree, Paul Anthony. I can't hear you anymore. Maybe there's something with the connection, but I do agree that also evidence-based decision making is extremely important, and perhaps youth could be the ones to advocate for this, for improving it. Yahaya, would you like to add something?
Yeah, yes, I completely agree with Anthony. As my background of research, and having so many people from everywhere, if all this which we are discussing right now could be backed up with at least research from everywhere showing the needs and what things should be done, to be so beneficial than having like 18 of us trying to know whatever the youth around the world are thinking. But if you want a multi-centered research finding around the world, cementing whatever what we said, it would be very beneficial. Over to you.
Thank you, Yahaya. Very, very good inputs. And what do we have here on the Mentimeter board? Let's take a look at this as well. So there should be more spaces and training as well then for youth to engage in dialogue, and they should be treated as equal experts, right? So they should also be provided with remuneration for their time. Definitely, this does not make sense if youth are just incorporated and they are not equally taken as experts, or they're not remunerated for their efforts. So beforehand, hands-on training and internships on the subject before making policies, better resources also for research, and also conducting then research with goals of making evidence-informed policy, right? So that's completely another thing, right? We are very often, we know about clinical research or how to do laboratory experiments while we study during our undergraduate studies, but we don't know that much on how to make health policy decisions and how to provide evidence and do research on these sorts of topics. Youth should be engaged with nominated leaders and Democrats so they can learn policy and what is going on currently and learn more about decision making as well. Advisory councils have been mentioned, mentorship programs, and also ideas to retain engagement. So not to just include youth when they're maybe in some organizations when they're young, but also to have this continuous engagement, as I understand. Conducting consultations, hopefully this consultation is also something that is interesting to you guys as well. For us, it's extremely valuable, all of this information. So it's also good to have surveys where youth can express their concerns. These should definitely be published then as well and provided to governments. And also including more than youth organizations and groups to these meetings and discussions. Very, very good. So as you know, this is the last question that we had out of our 5 questions for the roundtable. Are there perhaps some general comments from the audience that you would like to mention, or you feel that was not tackled, that you feel is also very important to speak out about? All right, so I will share with you just one last slide before we wrap up. So this is now the form for dissemination that I was talking to you about. We will also send out an email with the link. It's a Google form. It has exactly the same questions almost that we discussed through today. So, but if you have people, you're all from different organizations, right? As we saw from the first slide, if you could disseminate this within the next couple of days. So we will keep it open for the next 2 weeks to gather wider inputs on these same topics, then we would very, very highly appreciate it. So please do circulate this with your colleagues, with your partners, people within your organization. We'll also send it via email then as well. And that is actually it for today. I do know that we ran a couple of minutes over time, so thank you for staying with us who could. Please do stay engaged with what we are doing. We will also provide inputs on how it is going with the roundtable and the forum. Please do also register. I'll put this slide back to attend online the event itself. Yes, and if there's anything, then please do ask or comment or raise your hand.
And I would also add that we're going to have a Twitter hour on April 1st to discuss also additional questions and input regarding some of the youth issues, some of the questions that you have heard, and we're hoping for broader engagement as well. So please, if you are on Twitter, keep on the lookout for that, and make sure to join us on April 1st, which would be 2 days prior to the youth high level roundtable. And so thank you, everyone.
Thank you. Bye.